everyone. Today we are going to learn the pathogenesis of the anacardium. So as per Dr. C.M. Boger, the main action of the anacardium is on the four main things. Number one is on the mind, second on the nerves, third on the muscles, and fourth on the joints. So first is on the mind. So we all know the brain is having different lobes. First is the frontal lobe. So when the normal physiology of the frontal lobe is that we are getting our normal personality, we see our normal communication in the community, or that is in the society, how we communicate with different people. Even we see that what is our social behavior with them, what are our different emotions, how we are getting means how we are reacting with different people surrounding us, or in different circumstances, what are our reactions. That all the things are controlled by our frontal lobe. So when the frontal lobe of the anacardium patient is affected, the social behavior is getting unsocial. They are getting unsocial nature. So in the Boric it is written, they are very much malicious, wickedness. They want to achieve anything in their life either by hook or crook. So that is the nature. Even by emotionally also they become very much depressed, very much sulky, morose. Sadness is going to be seen in them. So that is the affection of frontal lobe. Second comes the parietal lobe. The normal function of the parietal lobe is related to the language, speech, our perception, reasoning capacity. So when these things are getting affected in the anacardium patient, the language, speech problems are going to be seen. The recalling capacity, what we had memorized in the past, that cannot be recalled easily by us. Because of that, they are very much having anxious nature, very much nervousness during the time of examinations. So we see in the Boric it is written for the examination funk, like gelsemium, even like argentum nitricum. So it is also the remedy for examination funk. Then third is all having action on temporal lobe. The temporal lobe is having main function related to our auditory sense. So when the anacardium patients auditory sense is getting disturbed, not only the difficulty in hearing, even tinnitus, but also the different delusion hallucinations are also present in them. There is a symptom written in the Boric, it is clairaudient, means they can hear different voice, especially of the dead people which are coming from far around, which are not present in the reality, but they think that some different dead people's voice they can hear which are coming from far around. So that is the thing in temporal lobe. And last comes the occipital lobe. In the occipital lobe, the main function is related to the vision. So their vision is also getting affected. So difficulty in vision and refractory problems are seen. But along with this, there is a delusion that object seems far off. Even suppose there is a book in front of me, they think the book is 2 to 3 kilometers away from me. So that is a thing seen in the anacardium mind affections. Second action we told, that is on the nerves. So for the nerves, number one action is on that of the nerve affecting the stomach. So nerve affecting the stomach is the pneumogastric, that is vagus nerve. So they are having the digestive problems, weak digestion. Always they are having fullness, distension in the abdomen, and always that is a peculiarity, plug-like sensation, choking sensation is seen in the abdominal, that is in the intestine. And always they are having relief in these things just only by eating. But that also it's for the temporary purpose. The temporary amelioration is seen in them by eating only. So that is the affection on the stomach, that is nerve affecting stomach. Then the nerves which also affect the skin are also present. So the urticaria, different type of eczematous condition. Even it is written, it is having specific action on the palm of the hands. So it is written, there is a symptom that there is a warts present on the palm of hands. So this is how the skin of the anacardium patient is affected. Then comes the action on the muscle and the joints. So in case of the muscle and the joints, the patient will be having their stiffness. Especially the rheumatic conditions are going to be seen in the anacardium. Means the rheumatism of the joints will be seen, but not only related to the joints. Remember that when the anacardium patient is telling related to the complaints of rheumatism, we should also think that the anacardium patient's rheumatism can also shift to the heart. So they may develop the rheumatic pericarditis in the later life. So the rheumatic pericarditis complaints are also very important in the anacardium. So This is all the related to the sphere of action and related to their pathogenesis of the anacardium as per Dr. C.M. Boger's action. So that's all for anacardium's action. Hope you like. Thank you.